Hello, and welcome to this virtual case study of the Healthy Brain Initiative. This presentation highlights an innovative approach by the Louisiana Department of Health to better meet the needs of dementia caregivers. I am John Sheehan, the Associate Director of Public Health for the Alzheimer's Association, and our main presenter today will be Gina Rossi, formerly with the Louisiana Department of Health, also known as LDH, and who now serves as an adjunct professor at Louisiana State University in the School of Social Work. Gina will walk us through LDH's Caregivers in the Workplace employee training module. By the end of this virtual case study, you will know that more and more people are providing care to people living with dementia, that workplaces provide a viable opportunity to reach those caregivers, and from Louisiana's example, we will learn how public health can help develop supportive policies and practices for caregivers. To quickly set the stage, I will briefly introduce the Healthy Brain Initiative, also known as HBI. The HBI is a public-private initiative that aims to fully integrate cognitive health into public health practice. The HBI's signature document is the roadmap, which you see on your screen, and it offers practical and expert-guided actions for state and local public health leaders to promote cognitive health, better care for people with cognitive impairment, and increase attention to caregivers. Its flexible agenda is grounded in public health approaches, allowing for ease of implementation and integration. There are 5 core areas covered by the HBI roadmap, which you also see on your screen, but today's session is focused on supporting caregivers. We encourage you to check out other virtual case studies for those additional core areas. As you will hear today, dementia caregiving is an issue that state and local public health agencies can take action on. Data collected by the Behavioral Risk Factor Surveillance System, or BRFSS, show us that the majority of dementia caregivers, nearly 75%, are in prime employment age, between the ages of 18 and 64. Many, if not most, of these dementia caregivers are in the workforce, which means one avenue to reach them is through the workplace. The RFSS data also show us what the burden of caregiving is on these individuals. We know that nearly 1/3 of them provide an average of 20 or more hours of care per week, and over half of them have been providing care for at least 2 years. Data like these really help make the case for why public health must take action. It is now my pleasure to turn it over to Gina Rossi. Gina?
Thank you, John. Thank you for inviting me today to talk about our efforts and what we completed with the Louisiana Department of Health. I want to say first that, our team composed of the Office of Aging and Adult Services, where I worked with Melissa on this effort, the Office of Public Health, and that was Robin Rhodes and her team, and also Avis Griffin, and the Alzheimer's Association, Louisiana Chapter, with Stacy Denham. So what we chose in our core area was to look at what we could do to engage the most caregivers, and we knew that many of these caregivers, the large amount that you talked about those figures, were working. And we decided that actually the Louisiana Department of Health, being such a large institution, had many working caregivers in our own large department. So our mission was that we decided that we were going to build a module for supervisors who would be able to identify and then help assist and give good referrals to their workers who were caregivers. So this was a learning module for supervisors that we developed, and then we uploaded it into what we call our LEO system, which is our Louisiana Employees Online system. And I'll talk about that here in a minute. So that was our main mission. Next. So our LEO, which is where we decided to house this training, the Louisiana Employees Online, is a large database where all the employees go to discuss, review, deal with their payroll, with their benefits. Their emergency contact is on there, and all mandatory and optional training is on this website. So as you know, an employee base such as a state agency like this has many mandatory educations, but they also offer optional training to improve employees' knowledge and for supervisors as well. At that time when we did this, the Louisiana Department of Health had 7,200 state employees, and we certainly thought that if we could build something this big, it would be a major pilot that we could then replicate in other state departments in the state of Louisiana. So this is a slide of this is the first slide in our training. As you see, it's Alzheimer's dementia, caregivers in the workplace. And here we also list Well Ahead. Well Ahead is a healthy initiative effort by our Office of Public Health. Robin Rhodes and her team work there, and I'm going to talk a little bit later about what are the huge benefits we did by initiating this, because this is something that went on to grow into more education for all employees in their Well Ahead section. So here you see our introduction and goals. What we decided we wanted to talk about was we needed to give them some baseline information to the supervisor so they could recognize just what their employee caregivers were going through. So we talked and we gave them the signs and symptoms, of course, the most important 10 signs and symptoms of Alzheimer's and dementia. But we also talked about who is a caregiver, because there was a lot of information that needed to be gleaned for them in terms of, we use at our agency, actually we use a lot the term formal caregiver, because a lot of the agencies that we work with are formal caregivers, but we needed to talk about informal caregivers, family members, and we also wanted to talk about remote and long distance caregivers, because they were also important as well, and they have a lot of stress that is probably affecting them at work. So we taught them to recognize the signs and symptoms of caregiver stress, and we wanted to give them some tips and to give them some information to know how they should approach the employee and how they should respond, because this is a pretty sensitive, it can be very touchy issue. Many supervisors don't know how to approach their workers who are dealing with personal things. And honestly, there are some HR issues that, could be consequences. So we wanted to help give them some things that could just open it up for discussion in terms of, if you need help, I just want you to know that there's help available, so they could then make a referral. But honestly, how to have a good relationship with their employees so that if that was an issue, their employees would also have comfort with them, because that issue might have been opened up earlier. We also provided some resources for them to employees, both on a national level. Of course, the Alzheimer's Association was an important resource for where to go to, but also some local resources where they could go. This is a well spot, and this is where I wanted to talk about. This is one of a large benefit that came out of our work together with the Office of Public Health. So they started having some information about healthy aging and also about dementia and Alzheimer's. So now this will go to live on in their website. So people have information about all of these areas in the Louisiana Department of Health's efforts to provide education, not just to their employees, but to the community at large. We're very proud of this. So of course, one of the major things that we wanted to talk about is about caregiving and work. We wanted to give them some information about what it might look like for people who are caregivers, so they could have some targets to see that, is this something going on with any of my employees? Is there a lot of leave of absence? Are they going in late? How it affects them. For example, we know that caregivers who are working often have to turn down a promotion, that many of them retire early, and what this creates for them later down the road in terms of losing job benefits, because their hours are either shortened or their accumulated benefits are reduced because they've turned down a promotion. So this was some information that we gave them. So I want to talk about some of the outcomes. What were the outcomes of our effort? Well, one of the main things, that we had a reinforced focus on Alzheimer's and other related dementia. In the Office of Aging and Adult Services, certainly this is a focus, but even in an office as ours, at the Office of Aging, it often was competing with other priorities that we were dealing with older adults. But it also really reinforced that we needed this as an overall focus in the state of Louisiana, and how the Office of Public Health would be important in that. And they really took that on, as you see in their well spot, but also in their other approaches, how they were going to educate the community. We decided that this training, we have pretty much a weekly newsletter that went out in the Louisiana Department of Health, and we talked about the training that would be available there. I don't remember if we said it in this slide, but I want to bring to your attention that one of the things that we did to also enhance attention to this was that we created a CEU for social workers, so that social workers in the Department of Health, which there are many, would be able to get a CEU. And I think this is addressed later. Yes, here we go. So this was a big benefit. There are 140 social workers in the Louisiana Department of Health, and we know that many of them needed to learn more about Alzheimer's and caregivers and how that affects working caregivers as well. So we decided that we were going to include in the module an opportunity for them to have a pre-test and a post-test. So when they completed a pre-test and a post-test and also a survey, they would have a certificate. So the certificate would allow them to go to the Louisiana, the social work board and have a CEU that was, CEU, which is 20 are required every year, social workers. And that was something that was very attractive to them. So our outcomes were that social workers were able to get a free CEU certificate. The CEUs were also available to LDH social workers. We said that. And then an important outcome was our bridge. We created a much stronger bridge with the Office of Public Health and the Office of Aging in creating this module. There's some lessons learned. Well, certainly, as always, there's a lot of lessons learned. We learned that we did not want to skimp on energy for leadership buy-in. This was a very important factor in getting more people signed on to the training, but also in terms of completing what we wanted to do in terms of using this as a pilot, because part of the leadership buy-in was having our leadership then go to other departments outside of our department, for example, our Department of Transportation, Children and Family Services, and that took a lot of energy that was often competing with other things that were going on in Louisiana at the time. I don't know if you remember, but we were still recovering from a major flood, and so that was something that our leadership was very involved in, and we really needed some more time and dedication to be able to sell this pilot to other departments, and we needed our leadership to help with that. The push for mandatory requirement. I wish now that we had made this a mandatory requirement in the LEO system for supervisors. At the time, we were thought, well, we would start with optional and see how that went. But I think that it really is important enough and significant issue that we should have gone ahead and tried to make this a mandatory requirement. And certainly that would have taken a whole nother level of energy, but I think it would have been worth it. The next thing was our follow-on with support groups. At the time, we were hoping that when we completed this, that we would have a support group that would be offered in-house. And we were not able to complete that effort, mainly time, but there were some other issues. It's a very sensitive issue to have a support group in the same location where many people work together, and honestly, that they might be in a support group with their supervisors. So those were things that needed to be vetted out in terms of where would the support group be, where would it be, how would you, move the support groups around or maybe split them up if so somebody was not necessarily in a support group with their supervisor. That might be kind of, awkward for them. The next thing is I wish that we had moved faster to replicate. I wish that, many things move on momentum, and we had momentum going. I wish we would have gone ahead and said, okay, we're going to go ahead and just move this over and replicate this in other departments, and just gone with that momentum. And of course, when you do something like that, it may not be perfect, but often these things, they kind of level out, or they work out themselves. I feel like if we had done this in another large department, maybe the Office of Children and Family Services, Department of Transportation, Department of Administration, that, we may have had a champion there to go ahead and take it and move it in the direction that needed to go on in their department. I learned a lot about what we needed to do in terms of preparing HR for this effort. There got to be, I'm not going to say tension, but certainly some meetings that took a lot of time, a lot of explaining with HR in terms of what was happening now and reminding them that these were issues that they were facing now they needed to address. And we were able to offer them some options because a lot of us knew that some of these options were already being taken. So it just needed to be formalized. I felt lucky that I was in a position that I worked well with the HR department, but also I had some freedom as a senior person there to be able to explain it well. And this is not something that a new person would have been able to handle. Like I said, I have since retired from there, and I was able to really take some risks, I want to say, how this is important to me and what I wanted them to get from this. And it worked out well, but it does take somebody who has the knowledge and the comfort level of working with HR in this. And finally, I want to say, boy, I had no idea how long it would take in terms of producing a module like this. I'm going to say that I guess I was very naive. I saw myself as, putting together a PowerPoint, doing the voiceover, and sending it on to be uploaded. And I recognized later, as as things get edited, how often it needed to be edited, and the back and forth that took. And I say this, not in a bad way, but very good edits that needed to be done, but just how much time that took. And then there was a voiceover component that, to have a professional voiceover, what that took, and for us to even meet with them about the voiceover to make sure that the things that we wanted pronounced and accentuated were done in the correct way. So that is something that I want to, make everybody aware of, that takes a lot of time.
Excellent. Thank you. Thank you so much, Gina. It's such an innovative approach to reach dementia caregivers in the workforce. I especially appreciated how the training helped educate those gatekeepers, the supervisors, and even the social workers who they either manage or they interact with a large group of people, training them, educating them in order for their knowledge to be applied to that large group of people and have that compassion applied to the large group of people is such a great way to reach individuals who are our dementia caregivers. Thank you so much for sharing this case study. It's a really great way that I hope other state and local public health leaders will be inspired by and hopefully replicate. To finish out today, in summary, we heard today how more and more people are providing care to persons living with dementia, and the toll that care takes on caregivers. We also heard how workplaces offer a ripe opportunity to reach caregivers and help understand their situations. One thing that we did hear about is how supportive caregiving policies can help keep valued employees around. And that's an area that I think we can easily see the benefit for. Gina did a wonderful job illustrating just one way that state or local public health leaders can educate others about the unique challenges faced by dementia caregivers. In doing so, public health can ensure that those caregivers know about and have access to supports and services. Thank you for listening to this virtual case study. You may find additional information at alz.org/publichealth. Please find the full HBI roadmap, primers on other core areas, state profiles, and data. To learn more, visit alz.org/publichealth, as well as cdc.gov/aging. Thank you again.